Good evening. Welcome to For the Record. Rheumatic heart disease is considered a major health problem in developing countries and a leading cause of premature death in Fiji and the world. It is a disease many in Fiji remain unaware of or don't know much about. As of 15 years ago, there was no program in Fiji that focused solely on rheumatic heart disease. But since then, the Ministry of Health has undertaken a concerted effort to address the issue. Joining me this evening to talk about rheumatic heart disease and rheumatic heart fever and what is being done and can be done about it, Mrs. Rosina Lailai, the Rheumatic Heart Disease Central Division Coordinator, and Dr. Saini Mariam Bolondundua, the Rheumatic Heart Disease Technical Advisor with the Ministry of Health. Later in the show, we'll be joined by Mbuli Wenigolo, a person living with rheumatic heart disease. Ladies, welcome to the show.
Thank you.
So let's start. The obvious question, Sai, is to ask what is rheumatic heart disease and why should people take notice and be concerned?
Thank you, Stan. So rheumatic heart disease, which we'll refer to as RHD in short, is actually a disease of obviously the heart, but in particular the heart valves. So it's the thickening and the scarring of heart valves, which which results in the heart valves not being able to function as they should, and causing heart some complications of the heart. So it's basically a disease of the heart valves.
And what causes it?
So to talk about rheumatic heart disease, it's a disease process. It takes stages, and rheumatic heart disease is a later or more severe stage of the disease process. Before, to talk about rheumatic heart disease and what causes it, you have to go back a few steps. And so before, at the very start, it starts with a germ, a bacteria called Streptococcus, group A strep. That germ is most commonly found in sore throats or skin sores, both of which are very common in Fiji, in our children. And so once someone has an infected sore throat or infected skin sores, if it's not treated, this germ is on those sore throats or skin sores, and then sets off a reaction, an autoimmune reaction in the body, which then leads to the next stage, which is called rheumatic fever. Rheumatic fever, the symptoms of rheumatic fever most commonly are sore and swollen joints, and fever, and sometimes chest pain, other symptoms which are not as common, but the main ones, the classical ones, are sore and swollen joints.
Swollen joints.
In kids, eh?
In kids.
We must remember that this is...
And as you mentioned, sore throat.
Sore throat, initially, yes.
So, Rosina, you've been working, you're the coordinator on rheumatic heart disease. They're saying it primarily affects the world's poorest and most disadvantaged populations. Is that true?
Yes, that's true, Stan. And looking back for Fiji, I think this is based purely on hygiene, the two major contributing factors to a kid getting rheumatic fever. This is mainly due to hygiene, poor hygiene, and poor sanitation.
Okay. And this link that you talked about, the acute rheumatic fever and then rheumatic heart disease. So the two links, so it is how it starts through the fever?
Yeah. So from the sore throat and sores to the rheumatic fever, which then, if you get repeated episodes of rheumatic fever and it's not treated, then it causes damage to the heart valves, which I was talking about earlier. And that's when it becomes rheumatic heart disease.
Because when people think sore throat, you think flu.
Sure.
You think something more common, then you'll be thinking RHD. No one will be thinking that far ahead.
Yeah.
And also a sore joint, people will say, oh, it's the cold. Or something to that effect. Eh?
Yeah.
So the two are clearly linked. And it's been described, as I mentioned earlier in the intro, as a leading cause of premature death. Please explain, what does it mean? What do you mean as a leading cause of premature death?
Premature death just basically means dying before you are expected to live. Like, so your normal life expectancy, a person has a life expectancy when they're born.
So in other words, not living to the full potential.
Correct.
They die within their productive age.
Yeah.
And most of the death cases, they range from 5 to 29. And RHD is the second highest cause of death.
So some of the most productive
years of
a person's life.
Yes.
Now, it also states here that RHD is a cause of fetal and maternal mortality. That it's a leading cause, and its effects on that has been underestimated. In the Pacific, it's a leading cause of maternal mortality. And one of the briefs I saw here is that cardiac disease in pregnancy is the third most common cause of maternal mortality in Fiji. And studies have shown that rheumatic heart disease was the most commonest cardiac lesion. Correct, Resina?
Yes.
Yeah, and that would be because it's undiagnosed.
So this is before the child gets it, the mother gets
Sorry,
it.
it's about the mother. We're
It's
talking
about
about the
the mother,
mother.
yeah.
Yes, leading cause of death in pregnant women. That's what it means. Maternal
In
mortality.
maternal mortality, yeah.
Yeah.
So just breaking it down because I'm no expert on these medical terms.
Sure.
So explain how serious this is and how mothers can be watchful of RHD or ARF.
So the thing about this condition, RHD, is sometimes it's you're not symptomatic, you don't have the symptoms, you feel well in yourself, and so it's that's what we term subclinical. It's not, yeah. And so a person may be going through life without showing symptoms, without knowing, and then it's when, and for example, when they become pregnant, that's when you've got another person on board, and so it places more strain on your heart. Your heart is working twice as hard so there's increased load in your heart, trying to work twice as hard. And if you can imagine a heart that's already been damaged, the valve's already been damaged, trying to do twice the work, that's when it gets picked up. And that's why we pick them up when they get pregnant. We don't necessarily pick them up earlier because they feel well in themselves. And then that's when they get picked up. And unfortunately, when they're pregnant and we pick them up, they're a bit, it's a bit late.
It's a bit late.
Yeah.
So it's very difficult to find this out earlier. Or how can pregnant women find out that this may be what she's having?
Early booking, if they come for early booking, that can be picked. The signs and symptoms can be picked during early booking. So mothers, pregnant mothers are encouraged by midwives and obs and gynae doctors they are encouraged to come for early booking at the antenatal clinic.
Early booking, very important. We will take a break now, and when we return after the break, we'll talk about the signs and symptoms that they need to look for. You're watching For the Record. We'll be right back. Welcome back. You're watching For the Record. We're discussing the issue of rheumatic heart disease and acute rheumatic fever. Did I get that correct?
Correct, Stanley.
Okay. So we were talking before we went to the break. We were going to discuss about the signs and symptoms of this disease. So how does RHD, rheumatic heart disease, work? What does it do? And what are the signs and symptoms that people in general need to look out for?
So, like I said before, before rheumatic heart disease is a preceding stage called the rheumatic fever stage. So we'll talk about the rheumatic fever and symptoms to watch out for. So if you have parents, or for the general public to be able to know and recognize if a child is showing them. So for rheumatic fever, the most common symptoms are sore and swollen joints.
Right.
So in these, the child may complain of not being able to get up one morning, and so it can be any joint, so the knee, the ankles, elbows, so that's one. So on swollen joints, they sometimes have a fever. Sometimes you can present with chest pain as well.
Chest pain. Yeah.
In a child, and so rheumatic fever is most common in the vulnerable age group, or the age group that is more susceptible to rheumatic fever is between the ages of 5 and 15.
5 and 15.
So in the age group, if you have...
So that's where parents need to be very...
vigilant.
Very vigilant. Is it easy to notice, these symptoms, or do they take a while before someone can find out that, no, it's not the cold, there's something big, more serious than this?
Thank you, Stan. The most important thing is if the parents are aware, if they have some knowledge about the disease, they would be able to identify that these could be the signs of rheumatic fever. And at this point, this show is part of the massive rheumatic fever campaign that the program is having currently. And what we want to advise our viewers, or parents and carers, if they have children between the age of 5 to 15 and the child complains of sore swollen joint, fever, chest pain, think rheumatic fever and take your child to the nearest health facility and get checked by a doctor.
All right. So I see here some of the other symptoms, such as skin rash, lumps under the skin, fever, jerky, uncontrolled movements, shortness of breath, and chest pain, which is a common symptoms. Okay, so if people notice these signs, you've mentioned that they should go to the nearest
health facility.
Take the child to the nearest health facility and get the child checked by a doctor.
So what check should they be asking for?
Well, they
like
will.
They go and say, "Can you check my child for rheumatic heart disease?"
Yeah, it doesn't hurt to say that. We want to empower people to, just to prompt their nurse or doctor and ask, "Could it be rheumatic fever?" Ask the question.
There's no harm in asking the doctor.
So what about the people in the rural areas and outer islands? Where they just have nursing stations. Are these nursing stations equipped to handle this? Checking on RHD and then making the referrals.
Yeah, I'll let Rosina answer this, but it's part of what she's doing. It's a part of what the program is doing to upskill or to have training for our medical officers and nurses around Fiji as well. And so Rosina does training to the nurses around Fiji. So that's the aim, to be able to
help the nurses to identify signs and symptoms, or if a child between the age of 5 to 15, say a 10-year-old child presents to a nurse at a nursing station. The child presents with sore joints. The nurse who has attended the training will be able to identify that is a possible sign of rheumatic fever, and she or he will have to make proper referral. So if I can ask,
what tests do they do? How do they identify, or what kind of tests do they do to check that, yes, this is rheumatic heart disease and not just
the common
in their capacity as a registered nurse out there? They are just to identify the signs and refer the case to a medical officer.
Okay. And then the medical officer does further tests?
Does further tests. There are a number of tests. We have echocardiography or heart scan. There are blood tests done, ESR, ASR, and also the throat swab to test for preceding evidence of streptococcal infection in the body. And there are other tests like chest X-ray and ECG itself.
To check it. Not many people know about it. As you said, you're running campaigns effectively trying to get more awareness, but it's quite prevalent, isn't it? I see that it affects 1 in 50 school-aged children. Is that correct?
Correct.
Yes, correct.
So there was a study done that found that prevalence rate. So if you think about it, 1 in 50, we have about 50 kids in one classroom.
Yeah, so one child in one classroom is affected by RHD.
Like we say, like one child in every classroom.
That's quite a stunning statistic.
It is.
And a lot of these people, or these children, are living with the condition and don't know it yet.
Don't know it. That's correct.
So what can one do to prevent a rheumatic heart disease or get it cured effectively? Can it be cured?
It cannot be cured. If you've reached the rheumatic heart disease stage, it cannot be cured. It can be controlled. It can be treated and controlled so it doesn't progress onto a more severe stage. But yeah, once you have the condition, fortunately, it can't be cured. You can have surgery to replace the valves, but
it's with you for life?
Correct.
It's with you for life?
Yes, if it's like RHD
If it's at the RHD stage. Yeah.
Right. So that means you just have to learn to manage it. So what's the treatment? And please advise on the importance of the treatment. And are these treatments readily available? Or are they costly? What's being done on this?
The treatment is a penicillin injection that the patient diagnosed with rheumatic fever or rheumatic heart disease will be receiving, and the minimum time for receiving this injection is like 10 years. So if somebody is diagnosed today, if a child is diagnosed today with rheumatic fever, that child will receive benzathine injection or benza injection. It's a penicillin injection. He will receive it, or she will receive it, for minimum 10 years.
So that's quite a treatment to be going through.
Once a month, once every 4 weeks?
Or once every 4 weeks.
For a duration of 10 years, minimum.
And this treatment is
Benza.
Benza, is it readily available? I mean, it's there, is it affordable?
Yes, it is readily available at any Ministry of Health facility, whether it's a health center or subdivisional hospital or a divisional hospital or a nursing station. There are sufficient Benza stock. There are times that we face shortage, but otherwise we have sufficient, there is a sufficient supply of Benza at every clinic.
Because as you said, one in every classroom. And that's probably the tip of the iceberg, some would say,
Correct.
of RHD. You're watching For the Record. We'll be back with more on the issue after the break. Welcome back to For the Record. We are discussing the issue of acute rheumatic fever and rheumatic heart disease. Let's talk about the Ministry of Health's efforts to address the issue. According to the brief I received, there was no program in the 1990s that focused solely on RHD. And while there were a lot of cases of the disease, there was no way to tightly monitor these cases because of the lack of funding and resources to run such a program. What's the situation now on this? How have things improved? Have they improved?
So there is a program now that we work for. So it's called the Fiji Rheumatic Heart Disease Prevention and Control Program. So this program was, we're fortunate enough, it's evolved over the years. It started back in 2004, and it started as a couple of research projects by clinicians and researchers who came over from Australia mostly, and the UK, and they did some research studies trying to ascertain the burden of disease, the number, the numbers, the statistics, what's the burden of the disease in Fiji, which is great. It set the groundwork. We then knew how big of a problem it was, and then we got funding in 2015 from MFAT New Zealand and Cure Kids New Zealand. It's a philanthropic charitable organization. So with these two, we got funding from them to fund this program, which is led by the Ministry of Health. So the program sits within the Ministry of Health, but with funding from these two agents. And it's enabled us to have a more concerted effort and more focused efforts and systematic efforts and interventions to try and both prevent this disease and control the ones who already have the disease.
So the funding has helped.
It has immensely.
With awareness, because at one time I would say that for many years it was like an unknown disease that was
definitely
here in the country and not many knew of.
With high mortalities, high death rates.
And not many people knew what were the reasons for those deaths.
Yes, exactly.
So it's based at the Children's Hospital at the... Where is the program based?
The program is based at the Wellness Center.
A wellness
Namosi
center.
House. It's
Ministry of Health.
Yeah, and it sits under Ministry of Health.
So you've spoken about the funding given by donor agencies of health. But what funding support is provided by government?
The ministry supplies. There's a funding line from government as well. So it's essentially a collaboration of.
Right. So the government is taking this seriously. And what campaigns, given that it was relatively recent where a concerted effort has been taken to address the rheumatic heart disease and create more awareness and trying to get people to understand the symptoms that we are discussing now. So, what campaigns have been undertaken? If we can discuss the campaigns, Christina, probably you've been involved in this.
Currently, we're running the rheumatic fever campaign that involves this awareness. For the record, we have audio and televised advertisements, and also we had this hibiscus queen sponsored by Cure Kids. Mbuli was going to appear in the last segment of the show, and this is rheumatic fever campaign. It's like mass media coverage. Creating awareness on rheumatic fever of parents and carers to get to understand what is rheumatic fever and what are the signs of rheumatic fever. And the other campaign was a Benza campaign launched last year
which
Right?
was making people aware of that penicillin that you
Yes,
spoke about.
well, the campaign, Benza campaign was aimed at controlling rheumatic heart disease and rheumatic fever. It was aimed at the people living with the disease themselves, with rheumatic fever and rheumatic heart disease. And the initial campaign was a sore throat can kill.
A sore throat can kill you.
Can kill.
Mm. And if you can, how successful were these campaigns? You know, have you seen a change in people's understanding and awareness and action on RHD?
So just to add to Resina's explanation about the Benza campaign. So the Benza campaign was targeted at the different portion of the population, those living with RHD. We specifically targeted them because we saw that their rates of them getting the injections, what we call adherence rates, of them coming in to get their injections was very poor. A couple of years ago, there was a study done, very poor, is what 12% our adherence rate. So this is like 12% of our kids who already had RHD, only 12% of them were coming in to get their injections.
Treatment.
Yeah, adequately. So that's what prompted the
In
Benza.
other words, the vast majority are sitting back,
Yes.
unaware, or if they know they're not doing anything about it, and the
Exactly.
situation is getting worse for them.
Yeah. They're getting more damage to their heart valves, and they're probably not aware, and then they get more the complications. And
when they report to the hospital, they're already in like late stage or very late stage.
Very difficult to do anything further.
Yes.
It's one of the funding efforts was the program was to put a mobile clinic vehicle that can go around and do tests in schools. How effective has that been in case of early detection?
it's been good. So you know, for any health care delivery, one of the main problems or one of the barriers for people getting treatment is access to the health services. So this is one way we try and reduce that barrier. So we take the service to them, and so having a mobile clinic has been good in that way because of our our geographical location, rural areas. So this mobile clinic has been good. We've been able to take it right to Tavioni and Bonolevu and
Maybe
the Western
West.
Division. And to be able to perform heart scans of the heart.
echo.
Yeah, which called echo.
Just going back to one of the things that we discussed earlier that was raised. So you're saying that all the medical practitioners, the nurses are aware of RHD and how to make the referral? Or do they have to do training from the wellness center?
Basically, they, like if a nurse hears like rheumatic fever, rheumatic heart disease, they know. But then they need to undergo training, like it's a one-day training. We have like a package designed for nurses where they'll sit and get to learn, study the finer details of the disease. So it will help them to identify these cases easily.
So just to increase their level of suspicion of RHD, when someone comes in, there's so many things you're thinking of what it could be, but to put rheumatic fever and rheumatic heart disease at the forefront of their thinking.
And so you could say the program's objective is prevention?
Yes.
By raising awareness on the dangers of these infections, or as you talked about that acute rheumatic fever, that stage that they need to be detected early. And then obviously to control if they're too late in detecting early. Would that be, you describe that as the two key areas of the campaign? Prevention and control?
Basically, yes, so the two, the prevention
Yes,
and the control.
prevention and
Yes.
control. First, the program is Fiji Rheumatic Heart Disease Prevention and Control Program.
Because you can't cure it.
Unfortunately.
All right, you're watching For the Record. We'll be right back. Welcome back to For the Record. We're joined now by Mbuli Wainingolo, who is 18 years old and a first-year student at USP studying marine science. And you were diagnosed with, you're a person living with rheumatic heart disease. You were diagnosed with RHD at the age of 11 whilst at Savo District School. How did you find out? How were you diagnosed that you had, what was it, acute rheumatic fever, or were you diagnosed with RHD?
I was diagnosed with RHD, rheumatic heart disease.
At 11 years old?
At 11 years old in 2010. I just got to know this year that the team at the ministry, they pick random schools. So I count myself lucky and blessed to have
It was
had...
by chance that they came
Yes.
across Savu
Yes.
District School.
Yes.
And basically, you were how did they informed you right there and then, or you went for further tests?
No, right there and then at school, we had the screening, and we had to stay back, me and a few other students. After a few days, we had to take our first benzathine injection. We were given the cards.
So it was that serious?
Yes.
And you this year entered the hibiscus pageant and used the platform to raise awareness about rheumatic fever and RHD. And it's powerful because it was your own story. That you used. So what was the experience like going up there and becoming an advocate, so to speak, on the issue?
To be the voice of young people who are living with rheumatic heart disease, and to stand up on that stage to let people know about rheumatic heart disease, it was a wonderful experience, getting the message out there, because at times when I tell people that I have rheumatic heart disease, they don't know. They ask for...
Obviously,
Yes.
you won't understand what
Yes.
it's about. Eh?
Yes.
So what do you answer? What do you say when they look at you and give you a blank look? Do you go further and explain what? How do you tell people what's the disease like and what can be done?
It's a disease that starts with that is caused by a germ, strep germ, and mainly with infections that are untreated. And then I tell my story that I used to have infections back when I was 9, 10.
So did you have the symptoms, the sore joints?
I did, yes.
And what did you think it was, or what did your parents think it was at that time?
Mom, we just discard it off as a sore throat, or it'll just come and go, so we just let it be until that year. Then it was confirmed.
That you found out what it was
Yes.
about. Eh? So you've been featuring, and you are featuring in the Rheumatic Fever Awareness Campaign. What's the main messages that's being made in these campaigns that you're featuring in?
First of all, to the young people who are like me, living with rheumatic heart disease, some of them might have stopped. And to encourage them to come back, to have that health-seeking behavior, come back, take their injection, take ownership of their health. And also to the parents and guardians, if they can also have that health-seeking behavior, identify the symptoms, know about the symptoms that their child might have, and to take them to the nearest clinic just for checkup.
To be on the alert, not
Yes.
to let things just go on as it is. Sally Mary, one of the key part of the program is supporting and empowering people living with rheumatic heart like Buldi. Eh? How effective has that been in the efforts of getting people to take ownership? I have RHD and I'm doing something about it.
So that's, we found, well, it's an approach that we've taken to try and increase their compliance to treatment. So, how I mentioned earlier how people were just not coming up for their treatment. So we found that congregating them, getting them together in groups, patients, people who live with the condition, getting them together in groups, getting them to share their own stories, their own journeys, their own experiences. Yeah, they're more. They've found them. The feedback that we've gotten from them is very positive. They say they've enjoyed them, and it's just a space where they can talk to other people who, they reckon they're on the same, similar pathways on, and so it's been a great way of first of educating them, second providing support for each other, and in that way, once they're empowered, they know the importance of why they need to take the treatment. Hopefully we'll see the results that their compliance to treatment will pick up. But also, it's about empowering the patients. We're moving towards empowering the patients. Gone are the days where the doctor is like a god-like status, where he knows everything. He tells the patients what to do, and that's it. Not questioned. We would like to empower patients to take like Mbuli said, take ownership of their own health and be able to ask, have the confidence to ask the doctor, what's this, and engage in that conversation, and for them to have a voice as well, to advocate for themselves. It'd be good to see the day when patients are able to advocate themselves.
To have a much stronger voice. Do you feel, are you part of a group that's of people living with RHD that's feeling that you have a stronger voice collectively?
Yes. I thought that I was alone. And then when I got invited to my first support group, it was really encouraging to learn about others' story and to get to know everyone. It's really empowering. Yes.
I'd like to ask you before we go to the break, what it's like living with RHD. Do you face any restrictions or challenges, or it's like normal? Is there anything different for someone who's living with RHD?
It's a normal routine every day, but I have to take note of the changes that happen in my body at times. In school, it's normal in school. I took part in cadets. I take part in physical activities, but I know when to
draw the line.
Yes.
Are there limitations on what they can participate in if they are diagnosed with acute rheumatic fever or rheumatic heart disease?
So it all depends on the severity of the condition itself. So there can be those with mild, moderate, or severe. So we take it by that case, a case by case basis. What we advise people who have it is just to, they're the best people to know their own body, and just know what your own body can do and not push it. But in saying that, like Mbuli, it's not restricted her.
If you're doing the treatment and managing it well, you live a normal life.
Correct.
You're watching For the Record. We'll be back after the break. Welcome back to For the Record. Now, on the issue of rheumatic heart disease and acute rheumatic fever, one of the major difficulties that we're seeing is measuring how many people die prematurely from this disease, or getting and gathering data on the disease. How is that being addressed?
So we've had a very exciting development just this year. We've got this new online database. It's called the Rheumatic Fever Information System, again made possible with our funding. And what it is a national register, and it's online, and it has all the known cases, all the diagnosed cases of either rheumatic fever or rheumatic heart disease in Fiji, which is, it's still, we've got over 4,000 cases in our system right now, but we're trying to update the system and clean the data there. But it's exciting because we now have a register in one place, which is accessible by other people from other places, health facilities, where they can check.
Because at one time, the country really didn't know how prevalent or how big the disease was in the country.
Yes.
I see that efforts to measure disease burden and institute control strategies were impeded by the lack of up-to-date data from endemic areas. So that is being addressed by this?
Yes, by this new database. Like we used to have them before, but just manual ones. Each health facility would have a register, filling in things. But to have a national one where it's all pulled together for easy reference as well is good.
It's good. Now, apart from the health burden, what are some of the other challenges associated with diseases, such as the economic burden? Because as we mentioned, it's taking a lot of young people, affecting a lot of young people at the most productive
years of their
lives. So what are some of the other burdens, such as the economic burden, that the country faces due to RHD?
Sure. So, we believe prevention is better than cure. And definitely, in the long term, it'll be more cost effective to put more resources and funding into prevention strategies. And so currently for rheumatic heart disease, we get about 60 in a year. We get about 60 rheumatic heart disease related deaths in a year in Fiji. And what this equates...
Sorry, how many?
60.
60.
And these are mostly younger people. And like you said, in the most productive years of their life.
That is quite a number dying from rheumatic heart
disease
disease
alone.
Yeah.
And unnecessary death, premature death. And so I think the cost, there was a study done by a researcher which he ascertained the cost, what it costs our government, or he estimated to cost about $6 million US dollars a year as a whole. He did this.
That's from the loss of productivity and loss of
yes.
earnings.
Exactly, yeah. So those are both direct and indirect costs. And so if you break it down to a patient, it was something like 5,500 per patient per year. And and that's, the hospital costs, the loss of productivity years and that. If you compare it to the prevention side, a vial of benzathine penicillin costs 80 cents.
Okay.
This is the unit cost at the FPBS, at the warehouse. So, and it's free in all the health facilities. If you buy from a community pharmacy, a private pharmacy, it's about $7 or $8. But a vial, 80 cents. If you're taking it every month for a year, the cost just almost $10. So compare that.
It's better to take the treatment. That is the message.
Yes.
And prevention is better than cure. And because there's no cure for this in fact. So let's just run through some of the key points that's been raised. It's one of the leading causes of premature deaths and maternal mortality in the country. As you mentioned, 60 RHD-related deaths reported in a year. Young children, between 5 and 15.
First affected by
it. It's this infection. It's 100% preventable.
Correct.
So it can be prevented. What are some of the ways it can be prevented, Bully?
Taking monthly injection, benzathine injection. That's mainly it.
To control it.
To control it.
Yeah.
To prevent it.
To prevent it.
Yeah. So to prevent it goes back to your, you're wanting to prevent the sore throats and the skin infections. So you're basically talking about clean. The hygiene, sanitation, new homes, schools, just taking care of those,
just
overcrowding.
Being mindful of those things. So it's again coming back to a clean, healthy lifestyle that
correct.
must be taken care of. Bully, I'll give you the last question. We have 60 seconds left. What message do you have for the public or your peers or those living with RHD on what they must do or how they must go forward in life despite having ARF or RHD?
To take their benza, even if they feel well. It can be a hassle, I know, but it is our health. And to our parents and guardians at home, have that health-seeking behavior, know the symptoms of rheumatic heart disease and rheumatic fever, and to take their child to get checked for rheumatic fever and rheumatic heart disease.
Checked regularly,
Yeah.
Bully Weiningol and Dr. Sandy Mary Bolondondo, thank you for joining me on For the Record.
Thank you for having us, Stan.
That was For the Record for the evening. We hope you enjoyed the show and will join us again next Sunday. Nanaman in the Lambatiki is next with his My Say. From me and the team, good night.